right, good morning, everyone. Obviously, we're doing class a little different today. I was in a pretty bad car accident on Saturday. My car got totaled and I am a walking bruise, essentially, which is why we're doing class online. I'm also at my parents' place in San Antonio, so if you hear some background noise or you see a dog or cat in the background, just know that that's one of the family pets just kind of wandering around. So we're going to go ahead and wrap up Chapter 17 today. We're going to talk about healthcare, a little bit about income tax and poverty. Okay, so last class we did talk about welfare and a little bit about education. So we're just going to keep on going with healthcare. So just as a reminder, if you have questions as we're going along, you can type them into the chat box, or you can use the hand raising icon at the bottom of your screen. All right, so in terms of health policy, there's two main institutions on the federal level. The first is the National Institutes of Health, or the NIH as it's also known. The NIH was created in 1937, and it does a lot of the biomedical research, so new medications, new vaccinations. The NIH has been working with companies like Pfizer to try and develop the COVID-19 vaccine. They spend about $32 billion in expenditures. So it was the NIH in the 1960s that linked cigarettes to cancer. So they were the ones to help us understand how bad smoking actually is for us, to force companies to put that warning pack on the label. They also do research on HIV/AIDS, spending about $33 billion a year. So they're trying to trace outbreaks. Because we are seeing an uptick in people using heroin, and heroin is usually an intravenous injection. People are sharing needles, which increases their risk of contracting HIV. So we're trying to target outbreaks, put money into more medication, and so on. The other major institution is the Centers for Disease Control, or the CDC as it's known. And they're in charge of monitoring the outbreak of diseases, implementing preventative measures, and coordinating public health measures. So they've been trying to keep an eye on the numbers for COVID, first versus second wave. Issues with states that are seeing higher numbers of cases. So they're working to keep track of cases and so on. Usually they're not dealing with a global pandemic. Usually it's something like an outbreak of measles or whooping cough that they're keeping an eye on. So the two big health institutes are the CDC and the NIH. There's also, of course, the federal grants that cover Medicaid. And they cost about $392 billion in money that the federal government gives to the states to cover Medicaid. 65% of Medicaid actually covers the elderly and the disabled. It's not necessarily covering low-income Americans. And part of that is because Medicaid has become the de facto financing for nursing home residents when they have nothing left. So when people run out of savings, Medicaid can help make up the difference when they have to go into an assisted care facility. So Medicaid covers about 72 million Americans. And again, the majority of them are the elderly and the disabled, not necessarily the poorest Americans. All right. Also, if you guys need me to pause for a minute before moving to the next slide, just let me know. So in terms of healthcare reform, the reality is for most people, they're not getting health insurance through their employer. Now, this makes sense for small business owners. Small businesses can't necessarily afford to pay health insurance. So it's understandable that unless you're working for a fairly big company, you're probably not getting your health care through your company. So only about 55% of the non-elderly get health care through their employer. So this means that people have to try and find health care through either buying private insurance, now the Affordable Care Act, or simply going without. Now, we do tend to take care of the elderly by providing them with health care through Medicare. And for the relatively poor and the disabled, they are largely covered by Medicaid. Medicare can also be given to someone who is considered completely disabled if they are a certain age or there's just no way that they can afford health care. So there's been a couple of attempts to fix the problem. It's not helpful that 45% of the non-elderly don't have access to health care through their job. So President Clinton in 1993 put together a package that would have limited the rising cost of healthcare by providing essentially universal healthcare. Universal healthcare is common in countries like Denmark, Sweden, Canada, quite frankly, most of the northern industrialized countries. But there was a lot of opposition to this plan. The healthcare companies didn't like the idea of the system being changed. And some people in the public liked their health insurance. So there was this concern that they would be forced onto a different plan when they actually liked their healthcare coverage. So he was unable to get Congress and the American people on board with the idea of providing universal health care. So that attempt failed. And then in 2003, Congress decided to add a prescription drug benefit packet to Medicare. The idea was that it would help with the high costs of prescription drugs for senior citizens. However, Congress did not allow the federal government to use its purchasing power to lower drug prices. So this was largely toothless. As you've seen, the cost of prescription drugs is going up. Type 1 and type 2 diabetics have a very hard time getting insulin. There isn't really a generic version of insulin. So it is a life-saving medication, but people are now paying over $100 a vial, close to $600, $700 a month. So we've had diabetics being forced to ration their insulin because they can't afford the high cost of it. We've had the cost of EpiPens went up by 2,000% when someone bought out the company. So now people didn't have the ability to buy EpiPens to handle allergic reactions. We've had cases where senior citizens will go to Canada or Mexico to get their medications. It's partly why we get so many winter Texans in the valley. We're super close to Mexico, so they can just go across the border and get their drugs for less than half the cost, as well as being able to see a doctor, a dentist, and so on. So unfortunately, this reform just didn't go far enough to be able to help people afford their prescriptions. Any questions before we move on? Everyone's good? Okay. All right, so the biggest healthcare reform in recent history was the Affordable Care Act, or as it's also known, Obamacare. People sometimes don't understand that they're the exact same thing. They are. Obamacare is the Affordable Care Act, or the ACA as it's also known. So the idea behind the Affordable Care Act was to help millions of Americans get access to health insurance. So basically, you got a tax subsidy. You would go into your state info on healthcare.gov. You would put in roughly how much you make a month, and you would get the cost of a subsidized health insurance plan. So let's say a plan you want would normally cost $300, but you get a tax subsidy, so you only pay $150 a month. So the idea was to subsidize healthcare to help people be able to get healthcare. So it created state-based insurance exchanges. Every state was required to set up insurance plans through the Affordable Care Act. So if you move states, you do have to re-sign up for the Affordable Care Act. Here's the biggest advantage the Affordable Care Act provided for healthcare. It no longer allows the insurance companies to deny coverage based on pre-existing conditions. So if you are diabetic, if you have had cancer, heart problems, lung problems, they can't deny you coverage or charge you twice as much in terms of premiums. Believe it or not, they used to charge women more for health insurance because they tried to argue that pregnancy was a pre-existing condition in women, as if we're born pregnant, which is, let's just face it, ridiculous. Hi, sorry, one of the dogs came in to say hello. Well, both of them. Okay, so what it did was it gave people access to healthcare. You can no longer be denied healthcare because of a pre-existing condition. By the way, this does not exist in other countries. They just call it your medical history. They don't call it a pre-existing condition. It's only here in the United States that we actually call it that. So that actually helped people get access to healthcare. Now, the downside to the Affordable Care Act was you were required to have insurance or face a tax penalty of about 1% of your yearly income, or $95. That part of the Affordable Care Act has been repealed. So you no longer have to pay a penalty if you don't have health insurance. So this is beneficial. The other big thing that this did was it allowed children to stay on their parents' health insurance until the age of 26. This was crucial because we had a lot of young people graduating college and not having access to health insurance. When the recession hit in 2008, 2009, a lot of college graduates had no choice but to take part-time jobs. And part-time jobs don't necessarily provide health insurance. So the idea was you could work a part-time job and still have health insurance. So that helped cover a lot of Americans there. There's also the expansion of Medicaid for working age adults without dependent children and anyone making less than $27,724 a year. So the plan was not perfect. but it has increased the number of people who now have access to health insurance, has made it easier for people to get coverage. Any questions or comments before we move on? Okay. So Republicans in Congress didn't like the Affordable Care Act, and it was pretty much a party line vote. Pretty much every Democrat voted in favor, every Republican against. So Republicans by 2016 had voted 62 times to repeal the Affordable Care Act. And every time it would get shot down. Republicans like John McCain would refuse to vote to repeal the Affordable Care Act because their constituents liked it. They would get phone calls and emails saying, please do not get rid of my health insurance. Please do not dump me back onto the market. So they tried multiple times, and they have not yet successfully repealed the act. There were issues with the website rollout. People would try to log on to healthcare.gov, and the website would keep crashing on them. They'd get maybe halfway through the application, and the website would go down. So it took quite a while for the Affordable Care Act to be rolled out and make sure people could get their application done in 1 or 2 sittings. So by April of 2014, 8 million Americans had signed up for the exchanges. So millions of Americans now have health insurance thanks to the Affordable Care Act. Again, it's not perfect, but it's a step in the right direction. People now have access to health insurance that wouldn't have it otherwise. So it's a very important step forward. Now, the law was challenged in the Supreme Court, and the Supreme Court did rule the act as constitutional. Basically, they said this falls under congressional powers of taxation. Now, there had been another provision that required states to expand Medicaid, or they would lose their existing Medicaid funding. The Supreme Court said Congress did not have the right to do this. So 19 states opted out of expanding Medicaid coverage, which left 3 million Americans without access to health insurance or access to Medicaid. And Texas was one of the states that refused to expand Medicaid. The other problem we saw with the Affordable Care Act was the fact that it required employers to provide contraception coverage at no cost as part of their health care coverage. Here's why it was important for women. Prior to this, women would sometimes have to pay $100 a month for their prescription birth control. Some women only pay $20, $30 a month, but the idea was contraception should be covered at no cost. So now most employers are required to provide contraception coverage, so women pay little or even nothing for access to birth control. A couple of religious companies sued to get out of this coverage. Hobby Lobby is owned by conservative Christians. So they sued and said, we don't want to provide contraception coverage because it violates the owner's religious beliefs. So eventually the Supreme Court did rule that a closely held corporation, which is one in which the owners are actively managing the company, don't have to provide contraception coverage. So Hobby Lobby does not have to provide contraception coverage, nor does Chick-fil-A, or religious colleges like Wheaton and others. So for employees who work for those companies, they have to apply for a supplemental contraception coverage, or they have to pay out of pocket. Now, it was controversial because on the one hand, you had business owners saying it violated my rights, but then you had the employees saying, but what about my rights? So then you had the question of, well, whose religious rights take precedence here? So some companies just don't offer the contraception coverage, and women who work for those companies have to figure out a way to pay for the contraception. And it's partly problematic because there are women who need birth control, not just for pregnancy prevention, but also to help with things like ovarian cysts, painful periods, things like various disorders. So sometimes it's needed for health reasons, not just to prevent pregnancy. Okay, now we're going to talk a little bit about housing. So prior to about the 1950s, 1960s, we had a large percentage of Americans living in overcrowded or substandard housing. So think of a 6-person family living in a 1-bedroom apartment, or people living in housing without running water, electricity, and so on. So the percentage of Americans in overcrowded housing dropped from 20% in 1940 to 9% by 1970. So this was a huge drop, and it was important for a couple of reasons. One, you no longer had people living in substandard, overcrowded, bad housing. And part of the way they helped with this was to create a system of housing vouchers, or what you commonly know as Section 8 housing, which is essentially federal assistance to help pay the rent. The problem with Section 8 public housing is there's a very long wait, about 5 to 10 years, because of the lack of housing vouchers. Also, originally, public housing was racially segregated, and they weren't built within the heart of the city where poor people would have access to public transportation, grocery stores, and so on. Now, over time, they did try to fix that and build like high-rise public housing in places like Chicago, New York, Boston, etc. So we fixed some of the problem, but there's still a very long wait to be able to get assistance with housing. And in the 1990s, the Department of Housing and Urban Development decided, let's get rid of these high-rise public housing buildings and create mixed income public housing. So essentially, you might have a family that needed rental assistance living next to a family that didn't. Here is the problem with this. Landlords prefer to rent to people who can afford the rent outright. So what landlords started doing was just renting to people who could afford the rent rather than providing Section 8 housing. So the idea was not very well thought through, because I didn't think about the reality of the fact that if you get rid of public housing, you're just going to create more problems down the line. And then, of course, we had the huge housing crisis that erupted in 2008. Um, the deregulations of banks and mortgage companies started allowing them to offer low-cost loans with higher payments due later that borrowers could not afford. So someone could get a mortgage for a $200,000 house, even though they could realistically only afford a house that's maybe $70,000, $80,000. So the interest rates would go up, the homeowner stopped being able to pay the mortgage, and over 5 million homes were lost to foreclosure. It was pretty bad. I mean, the number of people trying to sell their house skyrocketed. Banks weren't really making deals on houses that they should have been. The housing market just completely bottomed out. And it turned out that sometimes the banks were doing auto notices to foreclose without giving the homeowners proper documentation. So the banks were later sued and had to pay about $26 billion to homeowners who didn't receive proper notification of foreclosure. There was a particularly bad case where a woman was illegally foreclosed on. For some reason, Bank of America said that she was not paying her mortgage even though she was. So she went out one day and came back to find the bank had changed the locks on her door, and in the process of foreclosing, they managed to kill her pet parrot. Obviously, that's a problem, right? You can't have them kicking people out of their homes without due process and foreclosing on someone who is actually paying the mortgage. So the housing market took a hit, and the banks and mortgage companies were very heavily criticized for their lending practices. Any questions before we move on? Okay. So now we're going to break down how social policy impacts things like the elderly and different income levels. Social Security, by and large, has been a huge support for the elderly. The poverty rate for the elderly is down to about 10%. So because of Social Security, we no longer have the majority of the elderly people trying to get by on nothing or just not being able to exist. So Social Security has made a huge difference in terms of poverty for the elderly. Unfortunately, the senior citizens do reflect the demographics of the majority of the population, in that the poverty rate for African Americans and Latinos over 65 is 18% versus 7.8% for white senior citizens. Now, part of that, of course, is tied to the type of work that was done. African Americans and Latinos were routinely barred from fairly high-paying jobs, forced to work in low-income jobs like housekeeping, agriculture, and hard labor. So because of this, they do unfortunately live in poverty at much higher rates compared to white senior citizens. Now, the median income for senior citizens is a little under $37,000. Now, if you're living in the valley, that's pretty good. You can survive on that. It's harder when you're living in a bigger city. So it can provide for a lot of what they need. But we do see a fair number of senior citizens working part-time to supplement their Social Security. And so Social Security and Medicare are available for all senior citizens regardless of income or need. Now, obviously, a wealthy individual is not going to be needing Social Security or Medicare. But once you hit 65 and a half, you are eligible for Social Security and Medicare no matter what. So this makes senior citizens a very influential voting bloc. No politician is going to risk ticking off senior citizens by talking about reforming Social Security or Medicare. So politicians will spend a lot of time appealing to senior citizens to vote. Most ads, like we've mentioned before during a campaign, are geared towards senior citizens. So they do have a lot of influence in terms of voting. Okay, any questions or comments before we move on? Okay. I'm going to take a quick break because, well, actually, no, hang on. Let me finish the lecture and then I'll show you the dogs that are chilling with me. Okay. In terms of income, Social Security and Medicaid and Medicare have really helped the middle class in terms of not having to pay the high financial burden to care for their elderly parents. They no longer have to try and help them with housing, groceries, healthcare, and so on. So these policies have really helped the middle class be able to focus on their children, their homes, and so on. So it has been very, very helpful for middle class Americans. There's also the ability for employers and employees to have a subsidy for their health care. And also, if you own a home, you can deduct the amount paid on the interest on your mortgage from the income reported on your tax return. So it's basically a tax break. Also, if you have student loan debt, the interest that you pay on student loans is also tax deductible. So when I file my tax returns every year and I put in how much I've paid in student loan debt, that gets deducted from my total income. So there are some subsidies and tax breaks to help individuals who are owing money on a house, on student loans, etc. So tax expenditures cost the U.S. Treasury about $1.26 trillion every single year. And part of that is because of the constant tax cuts that get passed for the wealthy. They seem like a good idea. The problem is now you've lost that income. So we inevitably end up with a budget shortfall. So tax cuts are expensive. They are not something the government should be doing without thinking through the ramifications. You have to realize, they have to realize that if you cut taxes, it's going to cost the federal government money. So the more tax cuts the government passes, the worse our economy tends to end up being. So they seem like a great idea. They're just pretty expensive. Okay, any questions before I move on? Okay. All right. Social policies, unfortunately, don't tend to help the poor as much as we might like it to. Now, the Earned Income Tax Credit does help in terms of things like taking care of families and helping to pay the bills. But this tends to be a one-time credit. It does help that you can take a tax break when you have children. So you can claim your dependents on your taxes, and that is a form of a tax break. But the minimum wage has not kept up with inflation. We have not raised the minimum wage in over a decade. So unfortunately, the number of people living in poverty is going up instead of down. The minimum wage is sitting at $7.25 an hour. Realistically, it needs to be closer to $10 an hour. There is no state where a person making minimum wage can afford a 2-bedroom apartment on the minimum wage alone. So the minimum wage is no longer livable. So we are unfortunately seeing a problem with the income gap increasing and the inability for families to get out of poverty. Now, in terms of things like food stamps or SNAP, the average benefits for a family of 3 on the national level is $382 a month. That's pretty good. You could take care of your family's food needs on that money. Keep in mind this is the national average. It does take into consideration the fact that states like California and Minnesota are more generous with their benefits versus Texas and other states. Realistically, a family of 3 in Texas is probably getting closer to maybe $200 a month in SNAP benefits, if that. So that average is the national average. It's going to be significantly lower in states that just don't put a lot of money into the SNAP program. And the fact that states did not expand Medicaid means that 27% of Hispanics and 16% of African Americans don't have access to health care. So they're still dealing with the problems of not being able to afford to see a doctor, and all the problems that goes with that. Now, in terms of welfare, adults with dependent children can get financial support. If you have 2 kids and you're working, but it's just not enough to make ends meet, you can apply for welfare. And realistically, families on welfare do tend to also need Medicaid and the SNAP benefits, because it's just not feasible that they'll be able to take care of their children without assistance. But there's not a lot of organization of the poor and welfare recipients. We get into questions about the undeserving poor versus the deserving poor, the stereotyping of welfare recipients, and the fact that it is harder to organize the poor. Wealthier individuals have more time and resources available. Poor individuals, not so much. So it's hard to really organize and get support for low-income Americans. And there's still that belief that some people deserve help, some people don't. And with that kind of attitude, unfortunately, it just doesn't seem like we're really going to be trying to fix the problem anytime soon. All right, any questions, comments? Okay, so the last group we'll talk about are minorities, women, and children. Statistically speaking, more minorities do live in poverty and earn less compared to white Americans. The 2014 poverty rate for African Americans was 26.2%. For Latinos, it was 23.6% versus 10% for whites. So statistically speaking, minorities are more likely to live in poverty. Also, single mothers are twice as likely to live in poverty than the average American. Part of that is because of the income gap between men and women. Now, it has decreased, but on average, women only make about 78 cents for every dollar a man makes. So women are still earning less than men, which means a single mother is more likely to live in poverty. Single mothers also have to deal with the fact that going to work can be more expensive than staying on welfare. If you get a part-time job, by the time you add in childcare, transportation, and insurance, you may actually be poorer at the end of the month than you would be if you just stayed on welfare. Now, obviously, this is not how it should be, right? We should make it easier and encourage women to be able to go to work. So to try to fix this, they do allow working mothers to stay on welfare to help out. There is also subsidized child care, but it does add up. It does get expensive for single mothers to be able to provide food, shelter, health care, and pay someone to look after their children. So single mothers are unfortunately more likely to live in poverty compared to single fathers and compared to the average American. In terms of child poverty, the child poverty rate is at about 18.4%. And yes, this does come into play when we're talking about race. A little under 11% of white children live in poverty. 25% of Latino children live in poverty, and 28.7% of African American children live in poverty. And again, this is tied to the type of work their parents are doing. Because minorities earn less money, their children are unfortunately more likely to live in poverty. And Americans know there's a problem. We know there's a problem with poverty. We know there's a problem with lack of access to healthcare. But we don't agree on how to fix the problem. We do support spending on things like Social Security and Medicare, but Americans don't necessarily like the amount of money we pay for Medicaid, SNAP, and welfare benefits. We spend more on healthcare than any other advanced nation, but we still have the highest number of uninsured people of any developed nation. So there are real problems in this country. We have a high rate of homelessness, poverty, a healthcare system that just isn't working the way that it should. So we know there's a problem. We just can't figure out how to fix it. We just can't agree on what the solution should be. And realistically, until we figure out how to fix the problem, these problems aren't going away. All right, any questions? Okay, so either type into the chat box or use the hand raising icon to tell me how many of you actually have health insurance. Okay, David, you have health insurance. Okay, anyone else? Alejandro, okay, good, good. So that's at least 2. Okay. How many of you would support a major overhauling of the healthcare system? Creating a system where basically everyone has access to health insurance through the government. You can type that into the chat box. How many of you think we should be looking at overhauling the healthcare system? Okay. Alejandro, did you have a question? Okay. Anyone just want to share their thoughts on the current system with our healthcare or anything? Okay. So before we go, just a reminder, there is no class on Thursday because of Thanksgiving. So don't log in on Thursday. There won't be anybody here. Next week is the last week of classes. So we'll be covering chapter 18, which is foreign policy. So read the first half of chapter 18 for next Tuesday. I will post the final exam online next week. It is the exact same format as the midterm, 4 short essay questions. You'll have a week to do it. Open book and all of the rest. Are there any questions about the final? Yes, 4 response questions, exact same format as the midterm. 4 short essay questions. Yes, exact same format as the midterm. Yes. About a page to a page and a half per question. Double spaced. Good questions. Any other questions? Good question, David. I would prefer that it be all of the questions in one document. Just makes it easier for me to see that you have answered all the questions. So if you can upload it as one file, that would be better. Yes. and you will submit them through Blackboard. So the Dropbox will be open at the beginning of next week. All right, thank you guys very much. I appreciate you showing up given the last minute circumstances around all of this. Enjoy your Thanksgiving, stay safe. You can email me if you have any questions, or you can call or text me, and I'll see you guys in person on Tuesday. Have a great Thanksgiving. Stay safe.